A lot of patients with neck injuries will complain of neck pain. The second major complaint of these patients that suffer neck injuries are headaches. So you get hit in the head, you have a headache, everyone thinks it's in the head. Dizziness. Patients mean one of three things when they say they're dizzy. They either mean they're lightheaded, like they're going to pass out. They mean true vertigo, where they sense the world spinning around them like they're on a tilt-a-whirl at the state fair. Or they mean imbalance. And the vast majority of athletes that say they're dizzy are referring to imbalance. Now, the other interesting thing about neck injuries is injury to the neck can cause imbalance. There are 200 times more ligament and muscle receptors for position sense in the neck than anywhere else in the body. So when your neck gets injured, you're going to have this sense of imbalance and quote unquote dizziness. So when you read the laundry list of non-specific symptoms for concussion, and I'm going to emphasize non-specific, these symptoms are not just for concussion. The vast majority of them can also be explained by a neck injury. So there's a tremendous overlap. You get nausea, you get the headaches, you get light sensitivity. Bright lights bother the patients. And why do we know this? Because when we do nerve injections of these occipital nerves that are traumatized, and we inject them with steroids and anesthetics to shut them down for about 6 hours, the patients get a dramatic resolution of all of their quote unquote concussion symptoms. So how do you alleviate brain symptoms? By numbing a nerve at the back of the head? Because maybe the symptoms are coming from the nerve at the back of the head and not coming from the brain. And that's a great way to differentiate when patients have these injuries causing the symptoms versus those that are residual from quote unquote the brain injury or concussion.